Listeners of Sky 99.5. Always a pleasure to be in your company on a Sunday morning discussing health. You could just let me say a pleasant good morning to you. Just guide me as regards to name now, please.
Lady G.
Lady G. Okay, Lady G. So a pleasant good morning to you. And it's a pleasure to be in your company. And of course, we're discussing health, as I said before, health from a natural and integrated perspective. I am, to the listeners this morning, we're going to have a very interesting program. Keep in mind, of course, the program is, as usual, an interactive program. So, of course, uh, at some point in time, we're going to remind you of those telephone numbers and, of course, how you could actually contribute in asking your questions. Keep in mind, of course, the questions doesn't necessarily have to be based on what we're discussing, but of course, any question as regards to your health, any questions as regards to the products and services of Batson and Associates. Yours truly, Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where we support your health naturally. Now, the thing is, a number of individuals, I decided to speak about hypertension today. That's one of the things I'm going to speak about. And the reason why I decided to speak on that particular issue is, of course, because of the number of individuals that are seriously affected by hypertension, but they do really grasp how dangerous hypertension is as it relates to renal failure and kidney disease. So we're going to touch on that this morning because, a number of persons getting some serious wake-up calls as regards to, you go to the doctor, you do various tests, and then you realize, you're showing certain symptomology, swelling in your ankles, problems with always feeling dehydrated, issues associated with even seriously elevated high blood pressure levels. And then after a while, you are told that you have a kidney disease or you have renal problems. So that's one of the things that we're going to discuss. Keep in mind, too, we are live on our social media platforms. So we are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. So you could always add us, share us, tag us, and of course, get even this recording that we actually do here because all these are available on our Facebook. So, of course, you can do that. Keep in mind our locations. We are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Chagonas. That telephone number for Chagonas is 222-8261. That's 222-8261. And Debe, of course, is the corner of Ramsey Wood Trace and the SS Erin Main Road in Debe. That telephone number for Debe again is 223-7515. That's 223-7515. And let me, of course, say thanks to those of you who actually attended our symposium. We had our first of many health symposiums at our DB office, and that actually took place on Saturday, the 28th of October, and that was indeed quite successful. A number of persons turning out there for both the morning and the afternoon sessions. And of course, the next one we would be dealing with, or the next one we would be doing rather, would be, of course, for Chagonas, and then right after that would be Tobago. And of course, I also have some dates for you as to regards to when we would be in Tobago. We actually in Tobago from next week, please God. And that number for Tobago I will share with you as the program continues. So, of course, let me say a good morning again to our social media listeners. We have Miss Heather Lawrence. A pleasant good morning to you. Of course, we also have Miss Dawn Ellis, who has joined us from Columbus, Ohio. So, straight out the gates, high blood pressure. What is hypertension? Uh, can you have hypertension and not be aware that you are hypertensive? And what are some of the symptoms associated with high blood pressure? So, how would you know that you are hypertensive? Because one of the issues that we are concerned, when I say we, persons in the medical community, the medical field, I personally get very concerned. Just this week alone, I think I had in the consultations and in the reviews that I did, at least for this week, 20 persons, 25 persons that came as a result of kidney concerns. 25 persons, in 1 week. I mean, granted, our offices cover, a pretty broad enough spectrum because it's Chaguanas, DB, St. James, Tobago. So, we deal with a fair number of persons, but I mean, 25 persons in a week is still a lot. I was even telling one of the other consultants that work with me, he and I was saying Dr. Batson, but you realize this week we had a lot of persons who came because we do good work in that area, trying to help persons to rejuvenate their kidneys. I'm not even going to go into the argument where the Western medical doctors tell you that if you have a kidney problem, the problem cannot be corrected. I disagree with that completely, because the body has the distinct ability to heal and repair itself. But of course, your body could only do that based on what you now put in there, understanding that you have a situation that needs to be corrected. And I don't know if you follow me when I say that, in the sense that, there are certain rules to the human body, and if those rules are flouted, if they are not followed consistently, you're going to end up in serious, serious problems. And that's what we're going to speak about this morning as it relates to hypertension. Because Trinidad and Tobago, the listeners of Sky 99.5, and to the wider Caribbean and the world. If nobody in your life ever give you this piece of advice, please, please, please take this piece of advice I'm about to give you all this morning. Do not, I repeat, do not play games with hypertension. Hypertension is not playing games with you. And I'll explain to you what it is I'm speaking about. Because I think a lot of persons don't understand the seriousness and the severity of this until you're actually in the situation. The old people have a saying, they say an ounce of prevention is better than a pound of cure. You all understand what that means, right? Because if you look at an ounce in comparison to a pound, you're looking at a significant difference, right? 16 ounces is a pound, right? So they're saying to you, if 1 ounce of prevention is going to cost you, or prevent you from having to deal or correct a ratio of 1 to 16, that's what that basically is saying, that if you could be proactive, if you could look at certain things, you will save yourself a lot of problems. Okay? So we know with high blood pressure, you have different types of hypertension. You have primary hypertension and you have something known as secondary hypertension, right? Now, and you also have different types of hypertension as it relates. You can have pulmonary hypertension. Now, pulmonary hypertension is the worst type of hypertension. And I'll explain to you what pulmonary hypertension is. You have primarily in the human body as it relates to circulation, you have systemic circulation, which is below your heart, and you have pulmonary circulation, which is above your heart, right? And that's easy. If you go on Google and you look at pulmonary circulation, they will show you a diagram as regards to that. So, as I said, pulmonary circulation is above your heart and systemic circulation is below your heart. Now, pulmonary hypertension is hypertension that affects the pulmonary aspect of the circulatory system. So primarily, it is hypertension or high pressure of the pulmonary circulation aspect of the heart. Now, why that is dangerous is because pulmonary hypertension significantly affects blood circulation in your brain. I'll repeat that. Pulmonary hypertension significantly affects circulation in your brain, or what we refer to as your cerebral hemisphere. Why is that serious? Okay, well, that's where your brain is, that's where your eyes are. So persons who get strokes, right? We know about strokes, right? Strokes primarily have two types of strokes. You have ischemic strokes and you have hemorrhagic strokes. Now, ischemia is an indication, and because if when doctors send you to do CTs of your brain, or if it is they have to do MRIs of the brain, they can actually see something known as ischemic lesions. And ischemic lesions are indications that you would have had some sort of stroke in the past. Now you have, as I said, ischemic strokes and you have hemorrhagic strokes. So ischemic strokes are basically when blood flow is interrupted to the brain. So you now have an interruption as it relates to oxygen. right? We know the importance of blood. Blood is responsible for transporting oxygen and nutrients to cells in the body. So when you have ischemia or you have suffered an ischemic stroke, it means that at some point in time, the amount of blood and the amount of oxygen that is going to various parts of your brain may have been interrupted for a certain period of time. And that's primarily what an ischemic stroke is. A hemorrhagic stroke is when you have a lack of blood flow to the brain. However, you have rupturing. So there's some sort of bleeding. They are referred to as bleeding strokes. Now, why is that important? That is very important because the rehabilitation for strokes is a very detailed rehabilitation. So much so that what I mentioned as regards to the old people having a saying, an ounce of prevention is better than a pound of cure, that applies in that particular situation. Because if you have, in fact, gotten a stroke, your rehabilitation is primarily, it's going to cost you. It's going to cost you because you're going to have to get a physiotherapist. I don't know how much you know about physiotherapists, but physiotherapists are not people that we have in abundance in Trinidad and Tobago. In fact, that field is now becoming more and more popular because of what it really does, especially as it relates to rehabilitative physiotherapy. Right, that's becoming a big thing now because we have more and more people getting strokes and require a specific type of rehabilitation that physiotherapists would be able to give you. So physiotherapists, you would know, would be persons who primarily deal with the physiological aspect of the body in terms of anatomy and physiology. They can do massages. They can help you in certain areas of stretching, mobility, rehabilitative work, that type of thing, right? So, of course, if you have a stroke and there is impairment to the various parts of the brain, depending on the part of the brain where you get the stroke, it would affect things like your mobility, your eyesight, whatever it is. And rehabilitative therapy is going to be needed for that. Okay, good. You all follow me there. So in a case like that, that's going to be very costly. Then if you have to come to someone like myself and we have to do now a protocol to improve blood circulation, you're looking at things like nitric oxide, you're looking at improving the vasodilation, vasoconstriction in the body. You're going to, especially if you're a diabetic patient or a hypertensive patient, most likely if you have gotten a stroke, because strokes are usually suffered primarily by persons who have hypertension, especially pulmonary hypertension, right? So that's basically what that means. Now, there's something known as a TIA, which is an acronym for transient ischemic attack. Now, that is a mini stroke. So, ladies and gentlemen, if ever you are told that you suffered a mini stroke, you should be very, 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 put a million very in between that space there, concerned. Because it means that you are walking time bomb if you do not make certain corrections as regards to what it is you're doing and that type of thing. Right? Very, very, very serious. Now, I mentioned primary hypertension as well as secondary hypertension, right? So, of course, secondary hypertension would be hypertension that is as a result of a primary issue, which, quite frankly, is what disease is in the entire body, right? Any disease that you have is primarily a manifestation of some sort of imbalance in an earlier organ system. Usually, it is the gastrointestinal system that is the culprit, because that's the system that controls a number of things in the body. And if your gastrointestinal system is not functioning properly, you're going to basically end up, or you're a perfect candidate for a number of issues, especially cancer, which is something that you don't want to hear. I'm going to touch on that a bit because that's a next diagnosis that we get in a lot of, especially with very, very young people. So this week was not easy week. It was not easy week. And I mean, I always tell people I love what I do and I am quite good at what I do. But it always bothers me when people are almost walking blindly. And let me tell you something, plenty people walking blindly as regards to their health. And you all need to open your eyes some way. I always tell you all, I'm not in the politics of medicine, and I never would be. I am not in I really don't have time for that. And when I say politics, people who want to come and tell you, use this, use that. I went to the doctor tell you to go buy a herbalist, even though I'm not a herbalist. But of course, I have experience in botanical medicine and that type of thing, which of course is way more advanced than herbal medicine. And I'm not saying that to boast, but to state a fact, right? So that's why I say I'm not in that politics. My job is to get serious people better. You're serious, you want to get better, you come to Batson and Associates, you follow the protocol, and you are going to get some sort of improvement. Some sort of improvement. That has happened. That always happens. But Trinidad and Tobago, the listeners of Sky 99.5, persons out there, please, if you have high blood pressure, take better care of yourself. The numbers not lying. You know how much dialysis centers we have in this country? You know we don't have enough, and we have a few. Dialysis is not fun. It is not nice. It is an it is a means to an end. And I always tell persons that the road to hell is paved with good intentions. That's something I hear the old people say, and I totally believe it. The road to hell is paved with good intention. You are going to have a quality of life, What is the type or the quality of life that you're going to experience if you have to go on a dialysis machine? Young men especially, check yourself. A blood pressure machine is not an expensive item. You could walk into any one of those medical places that provide those things, various pharmacies, and purchase a good functioning blood pressure machine and do yourself a favor. And if not every day, every other day, test your blood pressure. Because what we're realizing, and this is something that I have seen years now, I've been seeing this over 10 years now, and I continue to warn people about it. Some listen, some don't, and that's fine. You cannot, because a lot of the times when you are diagnosed with hypertension, you were hypertensive maybe 2, 3, 4, 5 years before that. So your kidney already has been under pressure for a number of years. And that's why we have a lot of people coming now with stage 5. When they do the glomerular filtration rate, you are a stage 5 kidney patient. And a lot of these doctors not going to have patience to sit down and explain and go through all of this with you. They're going to sign a form, send you for a surgical procedure, which is for them to insert a catheter. Not a catheter, sorry. I forget the name of the device, my apologies. But they have to perform the surgery either in a major blood vessel in the neck area, or they actually use the ones very close in the arms, right? As the portal or the access, that's the access point for you to be hooked up to the dialysis machine. It is serious. Test your blood pressure. I had somebody this week that came, and one of the things, exactly what I'm discussing here, that's what happened to them. And the thing is, when they found out about the kidney problem, if you saw those numbers, because it's going to show, and I'm going to explain as the program continues why hypertension damages your kidney so much. A lot of persons have not made the link. A lot of people speak about diabetes. Now, diabetes is bad. I always tell persons diabetes is a horrible disease. But again, it comes down to what you do when you have these ailments and really working on the root cause of the problem and taking better care of yourself. Too many persons take these things for granted, and you're like ending up. Now, the thing is, you all know me. I'm as plain spoken as they come. And I always tell you that nobody's forcing you to do anything. You're an adult. I deal with little children, but when I deal with an adult, I'm treating you as such. So I'm not going to play games with you, So you have to check your numbers. This thing's serious, It's serious. Too many persons. I have reports of GFRs coming to my office, and the GFR is your glomerular filtration rate. In order for a doctor to know that you have a kidney or a renal problem, there are some tests that they normally do. They do a test known as a GFR, which is going to tell them the stage at which your kidney is at. Your kidney is supposed to be ideally, we like it. If you're stage 1, that's excellent. Stage 2, better. Well, stage 1 is better because in this particular case, with the kidneys, the lower the number, the more serious the problem is. Okay? So 1 means you're good. 2, you're good still. 3A, we could live with that. You see, when you start to go down to 3B, 4, and 5, I have a serious problem with that. Because what is going to happen, you are in a very close proximity to having a serious renal problem. And you know, one of the reasons why I am stressing on this, as it relates to the laws of anatomy and physiology in the body, let me tell you something about your kidney. Your kidney is the most, I personally qualified as the most, I wouldn't say ungrateful is the word. It is the organ that holds that grudge, or the biggest grudge. Your kidney really doesn't, it is a hard organ to fix. That's basically what I'm saying. Of all the organs in the human body, your kidney is one of the hardest organs to bring about rehabilitation. Let me put it like that. It is not impossible enough, but it is one of the most difficult because of how intricate the kidney is in its functions for the entire body. Because remember, what is the main function of your kidneys, right? Your kidney is primarily the filter of the human body, you know. Your kidney has to filter everything that passes through your blood. So that's one of the reasons too, when they do the kidney profile, they would look at things like your bond, your creatinine, things like your potassium, so that those numbers, when they higher, it shows that the strainer or the kidney is not functioning as it should, and you have certain things passing and getting into the blood. And I'll explain to you how that happens in a little bit. And the problem with that is, as I said, that organ is a very difficult organ to correct. So please take better care of yourself, especially if you have high blood pressure. If you have high blood pressure and diabetes, well, oh gosh, worse yet. Now, self, you have to take better care of yourself. But what makes hypertension so dangerous is that hypertension, do you know that if you are hypertensive and your hypertension is uncontrolled, all you're doing is taking medication, you don't care to drink water, you're still drinking coffee, you're eating how you want, you're doing all kind of nonsense, you're eating a lot of meat. There's a close link between meat consumption or excessive meat consumption and high blood pressure. That's the next thing a lot of people don't know. When you tell people who eat a lot of meat that it makes their blood pressure worse, or if you want to lower your blood pressure, naturally, one of the ways to do that is to decrease meat consumption, especially red meat, because of that whole nitrogenous waste and the breakdown in the body. That is a serious thing. You find that hypertension, coffee as well. If you have high blood pressure, coffee is not your friend. I am not like the rest that going to mama guy you and tell you what it is you want to know. I am telling you what you have to hear, whether you like it or not. Okay, fine, that's no problem. You know, there are other places you could go. That's not a problem. And I respect that. Because I believe in life you could agree to disagree. And vice versa. You could disagree to agree. If you understand what I'm saying. Right? So it's not about, but the facts are there. And if we look at the statistics that they have now, I was actually trying to do some work. I have to get some numbers again, because I've gotten numbers recently as regards to the kidneys and the relationship with hypertension in Trinidad and Tobago, and the amount of persons that we have on dialysis right now. That you are fighting a battle, you are fighting a losing battle if you do not take care of yourself and make the necessary changes to bring down that blood pressure. The medication alone cannot help you. And I say that respectfully. It cannot. Medication alone cannot help you. You know why? The medication for hypertension is one, emergency medication. That's when you're really supposed to use that. And two, what it does is basically corrects a situation quickly in emergency, but it's going to do that with some side effects. And everybody knows that. If you don't know that by now, well, I mean, I don't know if you're living under a rock, but that is what's going to happen. Hypertension medication is primarily what? Calcium channel blockers and beta blockers. They also have diuretics. So what you're essentially doing is basically, that's like having hypertension and just taking medication alone and not taking care of yourself. Is like driving down the highway and your one of the lights on your dashboard come up, whether it's the oil light or something, and you just continue about your way and you just drive, and you're driving harder, in fact. That is what suffering from hypertension is, and not taking care from a dietary perspective. I'm not asking you, I am telling you. Because that meat consumption, because of the nitrogenous waste, causes serious strain on your circulatory system, and it causes serious strain on the renal artery. And the renal artery leads to where? Your kidneys, right? So what happens is when that blood pressure is high, that elevation, it stretches certain aspects of the kidney, the nephrons, and that time, and it damages it. So when it stretches, what it does is like you have a strainer, and the strainer now, because of the stretching, has gotten holes in it. So the holes are larger, and as a result of that now, what is supposed to be filtered by the kidney cannot be filtered, and it gets into the blood. One of the most restrictive diets, and this is not only from a Western medical perspective, but even from integrative medicine, from a holistic perspective, when you have a kidney problem, your diet is the most restrictive in order for you to get better. So go, please, and purchase a machine if you do not have one, and mind your business. Test your blood pressure on a daily basis. Try and test it around the same time, because it doesn't make any sense you get up and you test it, because your blood pressure during different time of the day is going to read differently, right? Your blood pressure in the morning and blood pressure in the night is not going to read the same. If you take your blood pressure 6:30, so you're accustomed taking it 6:30 every morning, and you go and you take it 8:30, the reading is going to be slightly off. So in order to get some good empirical information, right, what you do is try and test your blood pressure at a particular time in the morning or a particular time in the day. Do not play with hypertension, Trinidad and Tobago. Stop doing that. You're like killing yourself, and you are going to end up on a dialysis machine. You know, somebody told me, it's like, Dr. Batson, I am not doing that. They could say what they want, I'm not doing that. People always say that. And when you see, you know, as the old people say, water more than flour, and you start to get problems, and then your family day and bawling and crying because they don't want you to die now, one of two things will happen. You'll either cave into the pressure, or you reach a point where you're unconscious, or you're in such a serious state that you are no longer able to speak for yourself, and somebody has to speak for you. That's what it is, you know. So don't think you could just go around and be machismo and beat your chest and say, well, if that happened to me, I want to let me dead. No, you're being ignorant and very, very dotish. Plain talk, bad manners. That's not the attitude to have. I mean, granted, I always tell persons, we're dealing with big people, we're dealing with adults. So I always tell adults, if you think that you should not be restricted in your diet, and you should not be restricted or told what to do in terms of drinking water, and you find people shouldn't tell you what to do because you reach an age where you figure that you just don't want any restrictions. Good, fine, I have no problem with that. Do not come to frustrate Dr. Batson one or anyone at Batson Associates. And then when you end up in your problems, as the people say, go with God. Stop wasting big people time, because you would have known the changes that you were supposed to make and you didn't make it. So don't blame anybody else. But at the end of the day, I could say that, but we're talking about family members here. So it's easier said than done, because these are people we love and we want them to take care of. So try your best and, open your thoughts. Our mind works best when it is open. See if you can do a little reading and educate yourself a bit, and stop walking around as if it is you're ignorant to the fact. Because that's the next thing. A lot of people who suffer from hypertension, they are very hardened people and do not link the reason why they are hypertensive. And that's why I'm having this discussion with you all this morning. Because you cannot fight it. You are good. Your body has rules, specific rules. And if you flout those laws, if you break those rules, you have consequences. And in some cases, the consequences for your actions is almost irreversible, especially with kidney problems. Especially with kidney problems. So please go get a machine, Do not be taking medication blindly. And even though I'm speaking about hypertension, I'm speaking in general, well, primarily with high blood pressure and diabetes. Because those are the two where you need to know your numbers on a consistent basis. The next numbers that you all should always know is the pressure in your eye. If you're a glaucoma patient, you all know what glaucoma is, right? Glaucoma is high ocular pressure. If you're a glaucoma patient, that is our next thing, know your numbers. A glaucoma test is not $1 million. You could walk in to an optician's office, kindly ask, good day, ma'am, good day, sir. I am a hypertensive. I suffer from glaucoma. I would like to have the pressure in my eye tested. Even if they charge you, they're not going to charge you $1 million to do it. Take it and know your numbers. Because reason being, you cannot wait 6 months to be testing those things. The time is too far. You know how much damage could take place with your eyes. You know how much damage could take place with your kidneys within a 6 months period. Now, granted, if you're in the clinic, remember the clinic has to schedule your appointments. You are not the only patient that they're dealing with. So in some cases, you might have to mind your business and take your money and go and check yourself. But you need to know what is going on with you. And a lot of persons who end up with renal failure, again, are persons who are waiting on the system because you have a clinic day a year from now, and you waiting on the clinic. No, 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 no. I'm not saying not to wait on the clinic, but with things like these, it is so crucial and vital and important that within that space of time, so many things could go wrong that it is better to check and find out. I'll tell you all something quickly, but before I tell you what I need to tell you as regards to that, I'm going to give you all experience I had with someone with glaucoma. And the reason the person ended up in that situation is because they were doing what it is I mentioned there. They were not paying attention to the numbers. Mind your business. You are a diabetic. I know you don't like to stick yourself with the needle, but you have to be responsible. You now have a lifestyle disease that I would hope that you're trying to make some corrections with. You're improving your water intake, you're trying to do some exercise, because those things help you, But you have to monitor and know your numbers. So I know it's not fun to be sticking yourself with a needle to check your blood sugar. People with diabetes is fed up, stick the finger. So sometimes you run out of space. You have no space to choke again. You're fed up. Your fingers choke up. You only see holes in it. Okay, good. It's annoying. You don't like to do it. However, it will save your life. So please test your sugar. Blood pressure, easier, because blood pressure apparatus easy to deal with. You don't have to choke yourself. You have the ones for the wrists. Those are very good. And you also have the regular ones for the arms. Get a good brand. They have some good brands there when you go wherever you go, or do some research ads. Get a machine and do not be lazy. Check your pressure daily. You could only manage what you measure. One of my professors taught me that. She said, when you dealing with your patients and your clients, always help them to understand that you could only manage what you measure. What does that mean? If you want to lose weight, could you go, because you cannot go on your thoughts and what you're seeing, because some people are very delusional, and I mean this in no way to be facetious or condescending. They're really delusional. So you might be on a diet and you want to lose weight, and you're making noise. Oh God, this diet isn't working. I'm still feeling heavy. My clothes still ain't fitting me. We cannot go on your feelings. What you will do, if you're going on a diet, you would go on a scale, you would track your measurements, you would look at various aspects, things like your visceral fat, organ fat, whatever the case may be. We have fancy things now for those things. And then you will track your progress over a period of time, right? So the same applies with high blood pressure. So you hypertensive, whenever you got your diagnosis, and you just taking tablet, you don't check nothing. The doctor tell you you're hypertensive, you take it. The reason why you need to check your numbers is that a number of things affect high blood pressure and diabetes. There are a number of variants that affect this. This is the next thing doctors don't tell you. There are a number of variables, I want to say, sorry, that affects your blood pressure and your blood sugar. So you have to test, because if you take medication blindly, the possibility exists that the blood sugar could go what? Too high or too low. And both are detrimental. The same thing with blood pressure. Your blood pressure could go too high it could go too low. And in both instances, it is severe ramifications associated with that. So I think that is a perfect example of the old people saying an ounce of prevention is better than a pound of cure. Go, get a machine, get a notebook, rule it up properly in school here. And this is for your benefit. This is not for my benefit. And don't we have your pressure? We're doing something here. So do it properly. Right? If you don't want to do it, you have children, you have grandchildren, you have somebody to help you. Get a book, you have diaries, rule up already with the date, you know what? And you put a nice table and you take your numbers. And you know why that is important too as well? When you are in the clinic, you know, some people have white coat syndrome. As soon as you go to a doctor, your blood pressure is 100 million over a next million. And that has nothing to do with you. That's your subconscious mind, which a lot of people cannot control. Right? But the thing is, if you have your notebook and you go to the doctor and the doctor say, but look, your pressure is 190 something over 100 and something, you have high blood pressure. You could say, doctor, okay, I respect what you're saying this morning with that test, but take a look at this. And you have your whole notebook there. So if the doctor look at the book and he see you're getting a 121 or 125, he would know that is a one-off situation and they can make adjustments to your medication. So the doctor is able to work better with you. But we could only work with you if we have information. We need information. And that is where you have to track your numbers. So with that being said, again, let me say a pleasant good morning to the listeners of Sky 99.5. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where we support your health naturally. Keep in mind those telephone numbers and locations. We are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chaguanas. That telephone number for Chaguanas is 222-8261. That's 222-8261. Debe is the corner of Ramsey Trace and the SS Erin Main Road in Debe. That telephone number for Debe is 223-7515. That's 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. That number for St. James is 220-8113. That's 220-8113. And Tobago is the Triangle Building in Scarborough, Tobago. That number for Tobago is 226-4553. That's 226-4553. Those of you who reside in Tobago, well, you all know we had to dot our I's and cross our T's with our new office that we finished, machinery-wise and that type of thing. So we will be up and ready for you guys from next week, please God. So those of you in Tobago, and they will, of course, give you my schedule. I should be in Tobago the week after, right? I'll give you those dates just now. And once you call Latoya in Tobago there, she would be able to give you that necessary information. That number for Tobago again is 226-4553. That's 226-4553. Miss Annabella Bay of Tobago, a pleasant good morning to you. And Annabella Bay says, finally, I know, my dear, but we're going to ensure that we do what we need to do and sort you guys out properly. Okay. To Lady G it is. Hello. Okay. So one of the things that we're going to do, the questions. Oh, good. Right. So one of the questions that someone asked, and I just want to touch on this before we go to the telephone lines. Lady G.
Here, are you ready to take calls?
Yes, I am. Yes, I'm ready to take calls.
What's the call? Guys, 333-9950. That's the WhatsApp. 625-2759-624-7729. Those are the numbers to call. We have a couple text messages, doctor. So I was just waiting on your cue. I know you said you were getting ready to take calls. Hi, good day, Lady G. Hi, Dr. Batson. Do you treat high blood pressure with a large heart, age 40 male? And second question is second scenario is high blood pressure, slight stroke on left side, but diagnosed with Parkinson's due to symptoms related to Parkinson's, age 80, female.
Okay. That's the first question. Okay, so as regards to the 40-year-old, yes, we can. We do treat. In fact, at that age, I mean, you would see some issues are related to hypertension there. So yeah, we do treat that. As regards to the situation with the Parkinson's stroke, that last person said they said is what, 8 years?
It's 80 years.
Yes.
80.
Yeah, of course, and we do deal with that situation as well. I mean, based on everything that I'm saying here, at Batson and Associates, we run an integrative health clinic and integrative in all aspects. So whether it's hypertension, diabetes, whatever the case may be, I have ensure that we carry excellent products for circulation. We getting like maybe about 10 new circulation products next year again. Currently, we have balanced circulation, which does a lot of work with high blood pressure. There's a new one that we have now called circulation regeneration, and that was a tea that we had before, but we actually bettered the tea now in terms of the taste. One, because it is all natural, no milk, no sugar. I always tell persons when you're using certain things, you leave those things out. The advanced circulation, which is the liquid product for circulation, we're going to have that back in stock, God's willing, from December. So yes, we do deal with those situations and those age groups as well. So yes.
All right. Another person is asking, my question to doctor today is that I would like to know when I will be able to get the cerebral and the sandulan in the Chaguanas branch, please, and thank you.
Okay, good. So Santulan we have gotten. The office would have started to call clients on Saturday itself. So we have Santulan in stock at all our offices now. Cerebral, we will get back in stock in the next week and a half. We have a lot of, well, because of the time of the year too. Remember, end of the year, Christmas. So we have a lot of delays and with those things. But yes, we do. So we have circulation tea in stock. We have balanced circulation. We have Santulan in stock. We also have Alkagen water. We have inflammation formula. All these things I mentioned here help with high blood pressure. We do often recommend that if you are a serious hypertensive individual, especially with the gentleman who mentioned the heart being swollen, because that's one of the other side effects or one of the other ramifications of hypertension. It can cause enlargement to the heart because of how the heart is constantly under pressure. Remember, high blood pressure is hypertension or high pressure in your arteries. You have three major blood vessels in the body: capillaries, arteries, and your veins. But remember, your arteries are larger. So when you have blood pressure coming from a large um a blood vessel into a smaller blood vessel. And that's primarily how you end up with renal failure, because what happens is because of that excessive pressure in the renal artery, which primarily feeds the kidneys, what you end up with is that high pressure. When it gets into the fine nephrons in the kidneys, they actually stretch them. And that's why I gave the analogy and said it's like a strainer with larger holes. So what happens is that's when things like creatinine, bond, potassium as well. You have to be very careful when you have problems with your kidneys as regards to potassium. And that's why I said the diet is so restrictive. Now, at Batson Associates, we do a specific diet and treatment protocol for kidney patients, which is not as restrictive, but it is restrictive in the sense that we take out the nonsense. So you cannot be using things like your sugar, you cannot be using, as I said, coffee, because of what it does, coffee is a diuretic, which means it causes your body, from a chemistry perspective, to lose sodium, and then water follows sodium. So it dehydrates you. So someone who's hypertensive doesn't want to be dehydrated. You need to be properly hydrated in order to have better blood pressure readings. Okay, next question.
Good morning to Mr. Dr. Batson and all your doctors that are working in your offices. I brought my son to the Chaguanas branch for a problem that he had. And your medical doctor there was wonderful. He was thorough, explained well, Dr. Boswante. And I must say, congratulations to him. He was pleasant too, informative, and everything. He even gave us our number if we have any problem that we could call him. And what he had recommended to my son is working well, because He didn't get anything to lose weight, but he is losing weight, and people are seeing it and telling him he's going off more. He's feeling a difference in his body. His skin is more clear. And I must say, I sent people by you before, and I always wanted to come, but I brought my son, and he got a good result. I bought the molasses and the water, and I've been drinking it every night before I go to sleep. And I like to come when you all having the symposium. If you could have it in the evening time, please.
No problem.
So thank you very much.
All right.
And they have to call him back for him to have a second.
Yeah, his next revisit.
Wonderful day, and Mr. Bossamante, God bless you. Continue to give you that wisdom, knowledge, and that beautiful smile. God love you all. Do you have any like gift package for Christmas? I would like to know because I want to bring my mother. Thank you very much.
All right, that was a voice note from Miss Charles in Carson Fields. Thank you
Okay.
so much, Miss Charles.
Thank you very much, Miss Charles.
Dr. Batson, what advice do you have for one who suffers with pelvic dyssynergia?
Pelvic dyssynergia. The thing is that that's an inflammatory response in the pelvis. Before I continue that, first of all, let me say thank you to Miss Charles for that. One of the things we always try to do at Batson and Associates is service oriented and service driven, and I really have some good consultants that work with me. They came good, and after God I was able to train them even better, and the results that they get, as she so rightfully said, even with things like weight loss. Because the thing is, with integrative medicine, what you do is when you start to fix the body, because some people come and say, Dr. Batson, I have diabetes, I have hypertension, I have heart problems, I have this. But so they figure, well, okay, the heart is bothering me the most. I want you to work on this first. It's not a matter of working on what first, but it's a matter of giving the body what the body needs, or working on the root aspect of the problem. And when you do that, then your results will always be some form of improvement. Okay, so I just needed to say that. Right. So as regards to the that aspect with the hip dysplasia situation there, that's primarily an inflammatory situation, inflammatory in terms of the musculoskeletal system. So when we're speaking about inflammation as it relates to the musculoskeletal system, we actually speaking about inflammation of bones, tendons, ligaments. So a lot of pain, swelling. You could have dislocation of various musculoskeletal parts in the body. So think of somebody, for example, you might reach a certain age and they tell you you have to do hip replacement. Now, the thing is, it's not a matter of doing a hip replacement, but it's a matter of, because of osteoarthritis, which is an inflammatory form of arthritis, however, which is what arthritis really is, but it is arthritis with osteoporosis aspect associated with it. So you all know what is osteoporosis, right? So your bones primarily.
Yes,
Oh, okay, right. So let me give you a quick explanation. So your bones are comprised of calcium, magnesium, and phosphorus, but it is in the form of something known as calcium phosphate. Now, the thyroid gland is responsible for telling your brain or controlling the amount of calcium that leaves your bones to get into your blood. Your bones are the warehouses for calcium. So, but calcium is an alkalizer. In chemistry, calcium is technically, it is an alkalizing mineral. So the thing is, the largest alkalining mineral in the body is calcium, and calcium is stored in your bones. So what happens in a situation with excess acid? In order to neutralize the acid, you need a base. So the most readily available alkalizer or base of the human body is calcium. So what your body does, because of excess acidity, things like lactic acidosis, acid reflux, things like problems associated with uric acid, so gout, the body constantly has to compensate for all this amount of acid by pulling calcium from your bones. So because of consistently taking that calcium, the bones are no longer as dense as they're supposed to, and they now have spaces technically inside of them. And as a result of that, now you are termed to have osteoporosis or brittle bones. What makes it worse for women is that women, because of estrogen and because of that situation with making children. So if you are female and you have children, you lose minerals. So you lose calcium, magnesium. The minerals that women lose the most during pregnancy is calcium, magnesium, uh, primarily. And as I said, you remember your bones are calcium, magnesium, and phosphorus. That's why sometimes when women make children, they lose teeth and all this type of thing, because your skeletal system becomes weakened. So now that situation can be corrected, because but one of the things that women also need to pay attention to is PMS, which is postmenopausal syndrome, which is our next big, that's like 15 programs there. That's a problem that we see in, literally, these women now, depression, anxiety. The thing is, we have people suffering that have no right to be suffering. And I say that as genuinely, it comes from a genuine place, believe me, because when I see people come to us, like with that same lady, I remember there was someone who came to us who had really bad arthritis. This arthritis was so bad that they were actually recommended to do knee replacements. Now, people who know me,
sorry to cut
no,
you.
no, go ahead. Right.
Diagnosed with stage 4 arthritis, which I didn't even know it had.
Yeah, you have stages of arthritis.
I didn't know that. So
Yeah.
when I went to associates, that's what they diagnosed me with. So now I have no cartilage in my knees, none
Okay.
whatsoever.
And let me tell you something.
Knee
Knee
replacement.
replacement. But do you know?
Told me years ago before he died,
Mm.
don't do it here.
And it's not even a matter of doing it here, because I'll tell you something. And this is to give insight. And this is not being critical of any surgeon or surgery or anything like that. Surgery should always be an emergency situation.
Or last resort.
Or last resort. But you see the last resort, we don't like the last resort. Because let me tell you, with knee replacement surgery, and where they tell you that you cannot get cartilage and bone can't make that's not true. Of course, that's not true. No. Let me explain something to you, my dear. What people have to understand, the human body has the ability to reverse and rejuvenate itself. God, in his wisdom, when he made man, knew exactly what he was doing. I want to get into the spiritual aspect of the thing and come and preach to people this morning. But the Bible tells you the wages of sin is death. Right? So because of sin, we're in the situation that we're in. Anyway, when it is you look at the way the body is designed, your bones rejuvenate themselves every 5 years, every 2 to 5 years. Every 2 to 5 years, you get new bones, The new bones that you get is dependent on the raw material that you put into your body. So think about this. If you, let's say, ladies, we know, okay, wedding season just went. Women have a tendency when they go into weddings, they always want to lose weight. I don't know who they're going to impress in the wedding. Or they're trying to look better than the bride, I don't know. But you want to look nice in your dress, whatever the case may be. So the point is, if you're going to this wedding, like you have to go to a wedding in 2 months or some function, you have to wear a special dress. You don't want this belly telling your next belly go wrong. You don't want that. You want to look nice, flat stomach and thing. What it is you're going to do, you tell me what diet would you go on, or what would you do based on what you know? Would you go and eat fried chicken?
No.
Would you? Good, right. Would you not attempt to do some sort of exercise?
Yes, you would do exercise as well.
Right. Would you not drink more water?
Yes, you have to, especially with how the weather is today.
Good. Right. So the point I'm making, the correction that you want, the weight loss that you want, you are going to go and do some sort of protocol, whether it's for a month or 2 months, in order to get those results that you're looking for. But you're not going to eat, as we said, you're going to eat your greens, do your exercise, drink your water. The point I'm making, if you do that consistently for an extended period of time, how would you look and feel as an individual? Not better? Mm-hmm. You think? Correct, right? Good. So with your bones now, all you have to do, and I always tell people about this, you see CMOS? Yeah, I just give away information. You see CMOS? There's a lady who gave us a testimony. She gave me a testimony before when she started with us. And when she came to see me Wednesday gone, she said, Dr. Batson, I'll give you a testimony again. Watch me. If it's the performance in the sense, when she came into the office, she said, Dr. Batson, watch me. I can't finish tell people about you. This lady could not walk upstairs, you know. Our Siobhan's office is our first floor office. When she came back, well, now she has been working with us. This is about maybe a year. She said, Dr. Batson, there is no pain whatsoever in this lady's knee. And I saw the x-ray. I have a copy of the x-ray. I have a copy of the CT scan. This lady's knee was in a mess completely. I doubt yours worse than her own. And let me tell you something. She got results. Because once you give your body what your body needs, your body is going to correct the situation. And that's why I used our easiest analogy as regards to the weight loss. The problem, my dear, is that people are not consistent and disciplined. Because let me tell you something. Knee replacement is not a walk in the park.
No, it isn't.
Any surgery, you know what they have to put inside of you? Some wonderful pieces of steel and that kind of thing. Those things eventually get embedded into the other tissue. Tissue is going to grow over that. Knee replacements only last 10 years. And let me tell you something. If you feel you have pain now, you don't want to get that kind of pain. Take what I'm telling you. The old people are saying there is no such thing as a shortcut. You get yourself some CMOS and go in the supermarket. They have something called gelatin. But you're not using the gelatin with sugar and flavor. You're using the clean, pure gelatin. And you take a tablespoon of gelatin with a tablespoon of CMOS every day. And you do that consistently for 8 weeks. Stop sugar. When I say stop sugar, if it is, you know, he has a sweet mouth, I don't know, as they're saying, right? If you know, you just drink soft drinks and coffee, and then you have to make the change. And the reason you have to make the change is this, Here why? Because inflammation is the root cause of all disease. People with arthritis have high levels of inflammation in their musculoskeletal system. Remember, you're trying to correct a problem. So you cannot be correcting. So you can't go 10 steps forwards. And then the diet is nonsense. You will go 20 steps backward. You will never see your way. You understand what I'm saying? And that is what people don't understand. You have to do it could fix it. The hardest organ in the body to deal with is your kidneys, and you see your eyes. I tell people, don't play with them two organs. They are the most unforgiving organ. They will watch you. Oh, you're coming to deal with me now? No. Turn back and think. They don't want to hear you. Those organs are but you see, bones and diabetes and heart and depression and no. I do it in my sleep. My two eye tie behind my back, blindfold. We could fix that. No, I'm telling you, we could fix that. But when you get kidney problems, that's why I started the program the way I started the program. You let have too much people suffering in this place. Too much. Dialysis is not fun. Anyway, let's go ahead. Any more questions?
Oh, yes, many more. Good morning, Dr. Batson. Can female hormone balance be treated with hypothyroid weight gain?
Okay, yes, of course. But the thing is, once you have a thyroid problem, it means you have an endocrine problem because your thyroid makes a part of your endocrine gland, endocrine system. So your endocrine system is your glands. Glands are responsible for the production of hormones. Hormones are chemical messengers. So once you have a thyroid problem, whether it's hypothyroidism, which is low thyroid, or hyperthyroidism, which is high thyroid function, that is an indication of a endocrine problem, which can be corrected. The thing is, all women who have things, for example, like polycystic ovarian syndrome, fibroids, endometriosis, infertility, adenomyosis, painful menstrual cycle, what those women have is hormonal imbalance. Hormonal imbalance comes from an imbalance or imbalance endocrine system. Now, the question is, what caused the endocrine system to go bad? That's the next question, right? Because you see, the thing is, sickness follows a domino effect. You know? If we have 100 dominoes and we push them down, which domino do we pick up first to fix the problem? You have 100 dominoes, so a domino effect, all of them line up nice. You push down the dominoes, all fall down. Which domino do you pick up first? The last one that fell or the first one?
The last one. Not the last one?
No, not the last one. all the others resting on the last one that fell.
Oh, yes, that's true. So you had to pick up the first one.
That is it. So you have to deal with the root cause of the problem.
And then, yeah.
Yep.
All right. Hi, good morning, Dr. Batson. I was in the Debe branch yesterday, and they didn't have any Santulan in stock.
Right. So that's why I said, my apologies, that all the offices have Santulan now. So what you'll do, just call tomorrow, please God. But they got stock early. They got that late last night or early this morning. They would have dropped. So all the offices have now. Okay. My apologies for that. Yeah.
Hi, good morning, Dr. Batson. I recently turned 50, and I started to, suddenly get upset stomach. The stomach always feeling upset, bloated, and gassy. What could you recommend for that? And actually, I went on the internet and I researched it, and they say that is part of one of the symptoms of menopause.
Mm-hmm.
So can I ask what you have for gassiness and bloated with upset stomach? Thank you.
Okay.
Gassiness and bloating.
Okay,
Yeah.
good question. First of all, the thing is, when you have problems with, there's something known as flatulence. That's the medical term for gas. Flatulence, bloating. Usually that has to do with improper digestion of your food. Now, there are a few things that people do that they're not supposed to do. Let me just run through as quick as possible. One, they eat and drink simultaneously. You're not supposed to do that. The good God, yeah, you need to, if you do have proper choppers, teeth, then make soup. I just tell people that, right? But the thing is, you want your food to digest properly. And in order for that to happen, you cannot eat. So let's say, for example, you're sitting down and you're having a meal. So you're having your protein, so you have fish, your complex carbohydrates, so you're having like provisions, and your vegetables. A meal like that, you should sit down and eat the meal. No liquid should be involved in that. The only liquid you should have maybe is, depending on your age, maybe a little older, so you don't want to choke, you might take a little water in between. But people drink copious amounts of fluids together with their meals. So, for example, people would drink. So a bad thing to do is, okay, you go out and you drink a glass of water as soon as you go for a meal, and then after that, now they bring something else for you to drink. So you might get soda or juice, and you drink that, and then the main course comes, and then you eat that. And so the problem is now you would have dissolved the digestive juices. Remember, in order for digestion to take place successfully, digestion is a whole process. Digestion starts with your eyes. I tell people, from the time you look at food, you start to what? Salivate. Saliva is part of the whole digestive process, right? So that entire aspect going through the alimentary canal and whatnot needs to be done in a particular way. And in order for it to be done properly, you cannot eat and drink at the same time. And next thing that a lot of persons do that is a bad habit is actually drinking cold water. Internally, the listeners of Sky 99.5, anyone listening to this program, cold beverages are not the best for you. Now, of course, if it is you're drinking a little juice, or you may have some sort of beverage, I don't expect you to drink the beverage hot in that particular case. But your water should be room temperature, and you should have at least 1 to 2 cups of hot tea during the day. If your schedule permits that or it doesn't permit it, see if you could fit it in, because it's going to help with gastrointestinal imbalance. There's a tea we carry at Batson Associates called Gastro Tea. That's actually a very good product, because it's a tea that actually helps persons with things like gastrointestinal reflux disease, acid reflux, burning, bloating, gas. We also carry a number of digestive aids. We have stem cell digestive. That's one of my favorites, because that actually helps to bring back balance in the intestines. That's the stem cell digestive that we have. We also have something known as digestive restore, which is a prebiotic, probiotic, and we carry digestive balance, which is a number of that's digestive enzymes, prebiotics, probiotics. So depending on your situation, then we're going to recommend those. Santulan, let me just say this quick. Santulan, which they're asking about, is a 7-channel detox. So you have 7 ways in which your body removes waste from itself. So your body, you have your kidney, your colon, your bloodstream, your liver, your lymphatic system, your skin, and your lungs. So the thing is, Santulan detoxifies those parts of the body. But the good thing about it, Santulan, is a tea. So it's very easy to use liquid. I like liquid supplementation because surface area to volume ratio, it digests very quickly in the body. That's why I love tea so much. I tell persons that's why our Asian counterparts, especially the Koreans, if you look at people who live in blue zones are where people live to be more than 100 years or 100. And if you look at what they do, they have a rich culture of drinking tea. Why is tea so good? Tea actually contains something is known as tannins, tannins, which gives tea the color and that type of thing. Tannins are known to have things like anthocyanins, antioxidants, and that type of thing. So those things actually support digestion. So those are some of the things that you could actually pay attention to help that flatulence, bloating, gas. As regards to the PMS aspect or it being associated or close to PMS, yes, it is. Because and I often tell women, once you have PMS, the thing is, a lot of women do not know they're suffering from PMS. So let me quickly say this: if you are nearing the point where you are no longer seeing your menstrual cycle, if you have went through menopause, and some years after you start to feel ill, all of a sudden your blood pressure start to go up, you're having problems sleeping, you're having problem with anxiety, you're having problems with depression, that is PMS. Just recently, I had someone who came to us and she was diagnosed with hypertension. But her hypertension, when she got the diagnosis, they told her she had primary hypertension. When she came to us, and the consultants did the test. I looked at all the reports. I said, but you do have primary hypertension. What you have is secondary hypertension. So she said, well, how you mean, Dr. Batson? I said, well, your endocrine system is out of balance. And what I am seeing here is that you have serious hormonal problems. So I asked, I said, have you gone through menopause as yet? And she said, yes, she did. She went through menopause like about 5 years ago. I said, all right, so this is what is going on now. So your hypertension is secondary to the hormonal imbalance challenge that you have because of PMS. So when we balance the hormones, the hypertension went. So yeah, that's what you have to do. And that's why we do blood analysis and the magnetic resonance analysis. Keep in mind we do have that package. The good thing about the symposium that we did is that persons who attended that symposium actually had some goodies that they got. And one of those is that they actually got 2 discounted coupons which they could share with anybody else, so they don't have to use it. It can be transferred, and we actually give them a period of time, because we Christmas coming just now, and then we have Carnival next year. So depending on what people do, we give you a period of time in which you can actually utilize that and do the blood analysis: live blood, dry blood, magnetic resonance analysis. And those were the tools, apart from 2 other tests I sent her to do, that helped me to understand that was the issue that she have. From the time I looked at that blood sample and I looked at the report the consultant brought for me, I knew it was hormonal imbalance. And once we fix the hormonal imbalance, listen carefully to me, we fix the hormonal imbalance, her blood pressure normalized. All right. So again, let me just give those telephone numbers quickly. Keep in mind, we are located in Shogunas. Shogunas is first floor Money Talks building in Montrose. Shogunas, that telephone number is 222-8261. That's 222-8261. Debe is the corner of Ramsey Wood Trace and the SS Erin Main Road in Debe. That number for Debe is 223-7515. That's 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. Keep in mind, all these offices have open clinic days, and open clinic days means you do not necessarily have to have an appointment. We do take walk-ins. However, if you plan on doing the live nutritional blood cell analysis and our MRA analysis, it means that you have to fast for 2 hours. Okay, but we do take walk-ins. St. James is Red Edge Mall, Western Main Road, St. James. That number for St. James is 220-8113. That's 220-8113. And of course, Tobago is the Triangle Building in Scarborough, Tobago. Next week, please God, Batson Associates will be in Tobago, and that's for the entire of next week and the week after. Right? That number for Tobago is 226. That's 226-4553. Again, that's 226-4553. Next question, my dear.
Next question. Good morning, Dr. Batson. How are water bladders formed and how to treat them and prevent them, as I keep getting them under my feet whenever I wear shoes for a long time in the day?
Okay, so the thing is, if you have a water bladder, it could be one of the things. Maybe you need to check your shoes in terms of um, the size of the shoes. Sometimes persons, if they use, I just saying, like people who work in industries and that kind of thing, if you use steel tip boots, for example, you need to be very careful. Sometimes what you have to do is make sure that you have proper cushion in there, so you know, get proper socks. They actually have medical socks now. I don't know if people know that you can actually wear. So I often tell persons you need to be careful with the circulation stockings. So we're not talking about circulation stockings, but there are some people, because of their profession, they stand for long hours. So you might be in nursing, you might be a barber, you might be a chef. So you know, any job that requires you to stand for long hours, make sure and get, you have medical shoes now. You also have those things that you could actually put in the soles. You know, there are a number of things that you could do. So I suggest you maybe explore that aspect. I mean, I don't know the hygiene aspect, and I'm not trying to again be condescending in any way, but you know which particular shoes too. You have to wear socks. I know some people have a tendency, they wear shoes without socks. How they do that, I don't know. That's not a good practice. Because it does encourage a number of things, including a not too hygienic situation. So once you have checked those and everything is okay, then the possibility exists too as well. You could need to look at your circulation. One of the things that I continue to see and realize is that a lot of persons suffering from poor circulation. Let me give you a quick example. There's something known as diabetic neuropathy, which is nerve damage associated with poor circulation associated with being a diabetic. So let's follow me there. You have something known as diabetic neuropathy, which is nerve damage associated with poor circulation as a result of being a diabetic. Oh, let's follow me there, right? Nice. Now, the thing is, you could have neuropathy and not have diabetes because there's something known as non-diabetic neuropathy. But neuropathy, all forms of neuropathy, is caused by poor circulation. So if you have problems with pins and needles, cramping your calves, burning on their feet, poor circulation, especially if you're a diabetic. You have high blood pressure, you also suffer from poor circulation because high blood pressure is a serious, serious indication of poor circulation, especially if you have pulmonary hypertension. Research that. There are a number of persons who suffer from hypertension and they do not know that is pulmonary hypertension you're suffering from. That is the worst form of hypertension. Pulmonary hypertension is so bad. I'll give you an example quickly. You can go to sleep and during the night, your blood pressure can become so elevated that you can lose your eyesight. Now, I've treated persons with this already, but because a lot of the times, the eyesight or the loss of sight is not permanent because of what we would have done with them and that type of thing. However, in instances where it is a consistent thing happening over a period of time, you can damage, especially the back of your eyes, because what it actually does, there's something known as retinopathy. Now, you have diabetic retinopathy, which is actually detached retina or bleeding at the back of the eyes. A lot of diabetics have that. So you need to be very, very careful where that is concerned. Someone asked a very important question. Let me just take this here and then I'll come back. Keep in mind, we are live on our social media platforms. We are Batson Associates on Facebook. On Instagram, we are Batson Associates TT. On YouTube, we are Batson Associates Limited. And on on YouTube, sorry, we are Batson Associates Trinidad. My apologies. And on TikTok, we are Batson and Associates. Someone on not Instagram, sorry, Facebook's Evita Byron asked, can diabetes be secondary to menopause also? Yes, it can. I have seen it on numerous occasions. So the question the person asked, just like how hypertension could be secondary hypertension, hormonal imbalance being the primary cause, the same applies to diabetes. Because I've actually there was this client I had, she had a situation where all of a sudden during the day, her blood sugar would just go excessively low or exceedingly low rather. Now she would be eating normally, yeah? But sometimes this blood sugar will just go down and she's weak. When they test it, it's 40, it's 50. So they came to us and we would have done our tests. They brought some reports to me, CBC, those things. And when I looked at it again, when the consultant brought the report for me, I said, but you have hormonal imbalance. She said, no, I don't have that, Dr. Batson. I am, they were like 60 something plus. I went through menopause years now, it is not. I say, okay. I say, but you're alive. And what a lot of women don't understand as well is that not because you went through menopause, all is well with your hormones. Once you're alive, remember the purposes or the purpose rather of hormones. Hormones are chemical messengers that carry messages to carry out specific aspect of biochemistry in the body. So, for example, your thyroid produces, you have something known as T3, T4. Those are some of the numbers doctors look at to determine if you have a thyroid problem. You also look at something known as TSH, which is thyroid stimulating hormone. So even in the case of women with menopause, remember, with menopause now, because of that ceasing, your estrogen levels are lower. But the thing is, a lot of persons only look at estrogen. Estrogen is not the only hormone that women or that is important to women throughout their life. Women need testosterone, of course, much lower than men, but they also need things like prolactin and gonadotropin, progesterone, and those type of things. Now, when it is you go through menopause, you have changes with those aspects, especially with the estrogen, which is why women experience things like vaginal dryness, problems with the osteoporosis, and that type of thing. So, I'm saying all of that to say that a lot of the time, ladies, when you are diagnosed with a problem, the problem that is not your issue. Your issue is the hormonal imbalance as a result of PMS. I'll give you a quick example again. Women who do hysterectomies. A hysterectomy is the surgical removal of your uterus. I think it's one of the worst surgeries in the world to do, simply because of what we call body mapping. Now, one of the difference with integrative doctors and when we train, we learn body mapping. What is body mapping? Body mapping means basically that organs cross each other in the body. So, for example, the purpose of a woman's uterus is not only for her to make children, your uterus and your ovary. One of the purpose of your uterus is also to help with fat metabolism, and it also helps with circulation in your systemic part of your body, or what is known as systemic circulation, which is circulation below your heart. So when women do hysterectomies, one of the biggest problems that they have is poor circulation, because you have removed a vital organ that deals with fat metabolism and circulation. And especially if you do a total hysterectomy, which means you remove your uterus as well as your ovaries. When you remove your ovaries is cross-linked to your central nervous system. So what happens to, and that's why women some years ago, even now, if you go and do a hysterectomy, you're going to what? Immediate menopause. Some women are branded as, they have to put you on psychiatric medication. Unfortunate, wrong in my opinion, if they really make a proper analysis, they'll understand that you need to bring back some balance to the body. So you could basically do alternative hormone therapy, which we do at Batson Associates. So you now have to put back certain things in the body. But I said all of that to say that you don't remove organs. And that's why I often tell persons, you don't take out organs just like that. Your gallbladder, for example, what's the purpose of your gallbladder? Your gallbladder is responsible for the emulsification of fat. Bile is produced to where? So the thing is, when you remove your gallbladder, you have digestive problems for the rest of your life. So, is that ends that means you will live, but your quality of life is what it is we're speaking about. Okay? Next question.
Dr. Batson, what can regeneration circulation be used if you do not have high blood pressure or diabetes? What are the benefits?
Oh, great question. Actually, it can. The good thing about that product, I really like this product. And why I like this product is because we did some serious work to get it the way I wanted it. Because I always believe when things taste good, so I try my best. in the work that I do to always get it. But no, don't mistake what I'm saying. If it has to taste bad, then you have to drink it just so tasting bad, right? But the good thing about this tea is that it helps with circulation in the entire aspect of the body. So it helps with pulmonary circulation, it helps with systemic circulation, and it also helps with what is known as microcirculation, which is circulation like tip of your fingers, tip of your toes. You know, there are some people, sometimes people have situations with poor circulation that is so bad that they do not feel certain parts of their body. And that happens a lot with diabetics, which is why, and that is why what I explained with the neuropathy situation. So when the nerves are damaged, it interferes with your ability to feel. So your sense of touch is seriously distorted. So that's why diabetics, imagine you have a 3-inch nail that went up in your foot. Listen to me. And you didn't feel it, and it was up there for like 2 weeks.
What?
Yeah. And those stories are not there. People, because, and that's why I always tell people when you're dealing with diabetes, but I will always maintain diabetes is bad. It's a horrible disease, but it is a disease or an imbalance that could be corrected, but you just have some work to do. You have some work to do. But because the ramifications or the consequences associated with diabetes is not nice, it is not nice at all. As a male, you have problems with erectile dysfunction, you have problems with your eyes. You can imagine you come into this world seeing, you know what color is, you know what is orange, you know what is blue, green, which is my favorite color. You know what is that you see your children, you see your wife, you see, and you reach a stage in your life you can't see again. I find that is a real hard thing, man. And the thing is, it could be avoided. A lot of the times, Lady G, people just, some of them don't care until it's too late, and some of them just don't know. So the ones who don't care, I really, you could skip me. The ones who don't know, who want to know and want help, that's the people I want to deal with.
Yeah.
You understand? Next question.
Morning. Very true question. Dr.Batson, morning, ma'am. Mr. And Mr. Batson, there's a good morning to you. Dr. Batson, I want to find out something from you. Do you see about people, do you see about 90 years of age who are not going off properly and the system fluctuating in a sense that we not going off, and we keep us strict. I just wanted to know somebody 90 years, what would you suggest I do? I'm looking for some help here. So just what I do with a person at 90 years of age and their system kind of fluctuating. This person had COVID, all kind of thing, and they went through a lot.
Okay.
So as you were talking about strain on the system, I believe it have a strain on the system. So that area, and can that person with that problem use cayenne pepper? I know it might be a little ticklish for you. If you choose to answer yes or no, you choose not to, But that question I wanted to ask you, can somebody like that with going through that situation, can they use cayenne pepper in the food? Yeah, and I just wanted to know, what you have in place for somebody 90 years of age who not going off as frequently as they're supposed to. And due to the COVID and everything, like the system fluctuated, and they have a little posture problem, So I just wanted to find out that from you, if you could assist me in that area, right? So I could bring them what to do, right? God bless you. Yeah, man. Bless you inside.
All right, nice. Yeah, man. Yeah, we can help in that situation. What I will tell you to do now, like from today, God's willing, until you're able, because 90 years, depending on when I say this, sometimes depending on what we need to do with the client. So somebody that age, I don't know how the mobility is. So that's one of the first things we need to take into consideration. What I could tell you will help is their water intake or their hydration. Now, one of the things that you experience with persons when they start to reach a particular age, they tend to give you problems to drink water. And the reason for this is because, you know, they reach an age and they find for them to get up to rush to go to the washroom. It's, you know, it's an annoyance in their mind. So I constantly always have to try to help older people to understand that yes, you got older and you don't want to be rushing to go to the washroom. However, you need to hydrate properly. So one of the first things you could do for that individual, sir, is start them off with or ensuring that their hydration is correct. When I say that the rule for drinking water is your body weight divided by 2 in ounces, there's a particular water we carry at Batson Associates called Alkagen water, which is actually a brand of alkaline water. And the thing is, I often tell persons that water was not made just to tell people, hey, we're trying to sell your water. The water actually does make a difference, because if you look at it from the perspective of chemistry, especially as regards, Bossman, to what you're talking about in terms of the not going off properly and problems with the prostate, it means that with that water, you automatically start to help them to go off easier, because that's one of the things that alkagen water would do. The water has something known as ORP, which is oxidative reduction potential, which basically means it's an antioxidant water. And then, of course, the pH of the water, which is percentage hydrogen, which is very important for helping with the evacuation of waste and that type of thing from the body, easing up strain on the colon and whatnot, would actually assist. Now, you also mentioned that the person had COVID. Now, remember, one of the things with COVID is COVID usually leaves certain organ systems affected, primarily cardiovascular, primarily respiratory systems. So in a case like that now, we could make some recommendations. I would definitely look at inflammation formula. The question as it relates to the cayenne pepper, I say yes. However, what I would suggest is you use a very small amount, and you could always reach out to my office and I could tell you how much. I wouldn't say how much over the radio, and then we could make the necessary adjustments. But that person could get help, man. I have dealt with persons. I had someone recently who was like, what, 92 years, and they had the same problem with improper evacuation of waste. And I had to explain what I just explained to that individual, because as I said, as people tend to get older, you find seniors just give you problems to drink water. So you actually have to come up with clever ways. They're like children. You know, remember they say, right? Once a man, twice a child. So is almost to now get them, not necessarily fool them, but get them in a situation to like water. So what I tell persons sometimes, you could actually do the water where you put like maybe a little a piece of carrot, or you could put a little bit of lime in the water, you know, to sort of change up the taste. Because again, when you reach a certain age too, that's the next problem you have. You find taste is kind of distorted. So by kind of flavor in the water. Now, when I say flavor the water, people, I never told you to go and put sugar in water. What I'm saying is a case you could put maybe a cucumber, you could put a little bit of lime in it. You know, where they cut like you get a piece of rough skin lemon, you cut it, to sort of encourage them to drink the water. Okay, that's one of the things that you could do. Of course, you could reach out to us further, and I could, you know, kind of dot my I's and cross my T's more based on additional information. So keep in mind those telephone numbers and location. We are located on the first floor of Money Talks Building. That's Money Talks Building in Montrose, Chaguanas. That number for Chaguanas is 222. That's 222-8261. 222-8261. Debe is the corner of Ramsonwood Trace and the SS Erin Main Road in Debe. That telephone number for Debe is 223-7515. That's 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. That number is 220-8113. That's 220-8113. And Tobago, of course, is the Triangle Building in Scarborough, Tobago. Tobago, Batson Associates will be in full session with you guys from next week and week after, and of course continuing from there. But you know, we schedule that office accordingly, right? Especially with myself. Keep in mind we have some really good consultants. Let me say a pleasant good morning to Mr. Bastamante. That's the gentleman that the lady was speaking about a while ago. Miss Karishma Ramdan, Mr. Paul Green, and Mr. Stefan Vialva. And to the others, of course, because we have some others joining us the end of this month and into next year because of the amount of workload we have. So you can, of course, call and get that information. Tobago, that number again is 226-4553. Lady G?
We're going to call on the line. Good morning.
Yeah, good morning. I have the question. What does he have to fight glaucoma? Glaucoma. What do you have in his arsenal to fight glaucoma, and how can he treat it? That is one. And if you put a tablespoon of sugar in a glass of water and drink it, and you take a tablespoon of sugar, put it in a gallon of water and drink it, will you have the same effects with the sugar?
Just now, before I go, hello? He gone already?
Yeah.
Oh, yeah, there? Okay, tell me something. What type of glaucoma is it? Open angle or close angle? You know?
That's why you say the nerves are being damaged or something like that, the nerves are...
Okay, good. So they tell you the nerves in your eye damage, but the question I'm asking, you said you have glaucoma. Did the doctor identify if it was open angle or closed angle glaucoma? Did he say? You're not sure? Okay. All right. Well, I'll answer for both aspects. All right? Okay, good. So before I go, he asked the question about the sugar. Okay, let me tell you. Sugar in water should only be something that someone who may be a diabetic on insulin, and maybe the insulin is excessive and the blood sugar goes low, that's the only time you should use that, right? Good. Ideally, you should use some sort of fruit and you could put it in the water. Now, when I say that, you're not putting that in a large amount of water for the day to stay there, right? So when I was saying the situation with the older persons and even with children, where you could actually put like a piece of fruit in water. So you just sort of change it, kind of, especially with children. As I say, when you deal with children, it's a negotiator because you want them to eat well, but you just have to find clever ways to get them to eat and drink well. Because children sometimes give a lot of problems to drink water. And that was one of the ways that I found that really helps, where you sort of flavor the water a little bit with some sort of fruit. And, you kind of get them to start there, and then, they move up. So ideally, that's what we're talking about, not sugar in the water, right? As it relates to glaucoma, so you have open angled and closed angled glaucoma. So what that means, glaucoma is high ocular pressure in the eyes. So the thing is, depending on how the pressure is in the eyes, you will get it either where the angle is as we refer to open angle, so it's faced out, or closed angle where it sort of leans in. Right? Now, in both cases, that is high ocular pressure. Now, people who suffer from glaucoma, one of the first things you need to do is pay attention to your water intake, because a lot of problems, if you are dehydrated, your likelihood of having glaucoma is significantly increased. One of the things too, as well, in terms of the treatment, we do treat it. There are a number of things we offer. We have IT. I carry a lot of products for eyes. We have a product known as Eye Optics Formula, which is basically an eye drop that helps in reducing the pressure in the eye naturally. But what Eye Optics Formula is basically a cleanser for the eyes. So it means now, what happens a lot of the times, remember, the way chemicals enter your body, they enter your body in a few ways, right? So chemicals enter your body dermally, which is through your skin. They also enter ocularly, which is through your eyes. So you get a lot of chemical exposure and a lot of things coming in the body via the eyes. So what happens? That's why people who work in certain industries, so if you're working in oil and gas, you might be a welder. So you're doing things like arc and acetylene, those type of welding. If it is you maybe dealing with auto mechanics, so you might be somebody who do auto body work. You might be someone who deals with woodwork, so you do lacquer and spraying and that type of thing. You're supposed to be using your various apparat. I forget what they call them. It's PP. Your protective gear now, so with your eyes and whatever the case may be. But still, because of how chemicals enter the body, you should detoxify your eyes, and that is what the eye drop does. Right? It is a non-steroid eye drop, and you basically put 2 drops in your eye, 2 in the morning, 2 in the evening. And we have gotten significant improvement with persons with glaucoma. It also helps with inflammation in the eyes. One of the things the gentleman mentioned, he spoke about where the doctor talked about like bleeding in the eyes. And that is what I was speaking about before. It is something known as detached retina. But you could have a detached retina, which is when your retina actually detach. Now, the thing is, usually they tell you that the only way to deal with that is by taking an injection in your eyes. I believe what they use is Avastin is one of the things that they put in the eyes. Now, I have seen instances where that may work. However, I find with diabetic patients, it doesn't work. Me personally, for the 14 years I've been doing what I've been doing, because I deal with a lot of diabetic patients, right? So that's one of the reasons that I had to do a protocol for eyes, and that's why I started dealing with eyes in general. And we have been dealing with eyes for like about 13 years, so much so that people thought I was actually an eye specialist, right? But that's not the case. But of course, my knowledge is broad as regards to that, and I always try to see where I can fit in and help people accordingly. So the long and short of the story is that I have an excellent protocol for any eye problem that you have, right? Including retinotis pigmentosa, which is one of the hardest and most difficult eye problems to deal with. So in that particular case, there are some things that we could recommend. What I would say too as well, as it relates to your eye health, and especially if you are diabetic, you need to have some sort of proactive ways in maintaining and protecting your eyes, especially if you use insulin. Because one of the big problems with insulin is that insulin significantly damages your eyesight, significantly damages your eyesight. Okay, so it is really, really something that you need to pay attention to. All right. So again, you can feel free to give us a call or visit. Let me just answer this question quickly before we go back to the radio. Shamsmet says, "Good morning, Dr. Batson. Listening to you, I am aware you prefer to do a consultation before giving products, and that's true. And because I try always to, dot my I's and cross my T's, and it's very important to find out certain things. Of course, the more information we have, the better we're able to help you, right?" She says, "Before giving products, but for a person unemployed hearing you and want to purchase a product, what would you allow it?" The thing is, we do, in all honesty, I mean, because you could get Santulan, you could get Alkagen water. People come in and buy Nerve Restore. There are a number of products that we carry. So it's not necessarily sometimes all the time for a consultation, especially, we know COVID, we know people have economic situation, and that's something that I am fully aware of and try my best to work with people within reason. So yes, you could always come. Our front desk staff is very well trained, and of course, we usually have a consultant always in the office. So I mean, it doesn't take anything out of us to have a 5 minutes, chat with you, A, B, C, D, and of course, get you to the point where you can actually start to get some results. All right. So it's not a hard and fast, but you're always able to make some allocations there. We have to be reasonable, and of course, different circumstances with different individuals, would allow that. So don't let that stop you. You could always come and because teas that we carry a wide range of tea, eye tea, circulation tea, kidney tea. We have some new stuff coming next year. Please God, men, I'm making sure I get a proper tea for you guys for your prostate. That's something that we have been working on. We also going to do some work because of this PMS situation. We have an entire hormone replacement therapy protocol that we're doing because of the work that I've been doing now with a lot of persons with depression, anxiety, because mental illness is a real thing in Trinidad and Tobago. And COVID really did a number on a lot of us, mentally, psychologically, emotionally. Some of us don't really realize it, but it has. And depression is actually there's something known as functional depression, which has actually taken the world by storm, especially since COVID-19. Functional, there are a lot of people who are functionally depressed. And it is dangerous because with functional depression, you could reach a point where you're very close to a nervous breakdown. And then you go to the doctor and you're diagnosed based on the symptomology. So they either tell you you're schizophrenic, you're bipolar, because I'll tell you something. People who have dreams, and because when you have schizophrenia and bipolar, some people would have visions, or well, not necessarily visions, they would have well, yeah, call it visions or dreams of actually hurting themselves, and and I often, not to stray too much, just touching on mental illness here, because mental illness is a real thing. I feel concerned for a lot of persons because I've seen a lot of persons being told that they have bipolar, they are schizophrenic, and that is not what they have. What they suffered is a nervous breakdown. And because their nerves are so wrecked and damaged, the symptomology that they experience. Because if your nerves rectum damage, you're going to have dreams. Because remember, that is the way the human body is designed. You have your spiritual body, which is your first body, right? And I tell people that, and sometimes they get confused when I say that, but all that simply means is that there has to be some spiritual aspect of you as a human being. And I don't get into religion for a number of reasons, but I tell persons you have to understand that there's some level of spirituality. So as a being, the way you were designed with some sorts of spirituality associated with you. And that has been proven, right? So, meditation, a little deep breathing, you get up in the morning, you say prayers. I'm not telling you who to pray to, how to pray to, but you have to have some sort of spirituality there. That's the first body. Your second body is what is known as your supramental body, which is your subconscious mind. Now, this is a very important thing because when you are trained to do hypnosis or what is known as neuro-linguistic programming, which I am trained to do, but I don't really practice it, you understand how to separate your conscious mind from your subconscious mind. And I'm not trying to frighten anybody here, but there are things that you do because that's how we learn, especially if you're doing counseling and people who trained to do hypnosis. Because when you are hypnotized or the new name is neuro-linguistic programming. They no longer call it hypnosis again, right? You are actually trained to tap into that part, and that is where you get like regress feelings and emotions and trauma, childhood trauma. Those things are tucked away and hide. They actually hid in the subconscious mind, right? That is not in your conscious mind, obviously, right? So a lot of the times we train to take those things out, for you to deal with it and whatever the case may be. But the point is, with the subconscious mind, your subconscious mind is known as your supramental body. Now you have your mental body now, which is your conscious mind. And that is where you have the ability where we look at the neurological aspect now. So we're actually looking at the tangible aspect of the neurological part of the body, right? And that is why psychiatrists and psychologists, how are they able to determine certain things? By observing what? Behavior. Nobody could read your mind, right? But behavior is a manifestation of your conscious mind, right? Are you following me? And then you have what is known as your energy body. So the energy body, or what we call the vital body. So the first is the spiritual, the second is the supramental or the subconscious mind, the third is your conscious mind or the neurological aspect where we are actually able to now look at behavior, and then from behavior you are able to know. So that is where you're able to observe. And then you have the vital body, which is the energy body, which you could actually, that is where things like again, deep breathing comes in, meditation comes in. That's where taking a rest comes in. That's where vacationing comes in. Go and take a rest. Sometimes you're working hard but you need to feed that energy body. That's where things like massages comes in. That's when you're talking about things like chakra and your prana and that whole energy aspect. And energy speaks, right? I don't want to explain that. If somebody walk in that room and they have bad energy, I can tell you. Good, bad. You just know, right? If you and your wife vex and always sleeping on that bed vex, that energy in that room is a different energy. That whole, watch me. That's when people tell you you could cut the tension in the room with a knife. You ever hear people say that? Because energy is just that, right? And then you have your last body, which is your physical body, right? Now, your physical body in emergency is the body that require the most amount of attention. So God forbid you're in an accident, you fall down, you have a gunshot wound, something, the emergency. You go to the hospital, emergency. They have to injection, you need to get emergency surgery, whatever the case may be. In case of a heart problem, that's where they shock you. We have to get that adrenaline going, get back the heart beating. That is where the emergency comes in. So Batson and Associates don't deal with that, I always tell persons, you have different doctors for different times and different reasons. And that's why I do get into the politics. I'm not having any argumentative conversation with anybody about what I do. I ain't going through that, right? There are different doctors for different times. So when you're in emergency, it's hospital for you. And that's why I often tell persons that the hospital is for emergency. The hospital is not a hotel, you know. For some reason, some people feel, you all see this time of the year coming up. What coming up? Christmas, and next year is what? Carnival, right? Do you know that that is the time the hospital is filled with people who have no right to be there? Because you have high blood pressure, but Christmas come in. So you wouldn't take a little piece of the people ham. You want to sit down and eat the whole ham, and you know you're hypertensive. You are going to end up in some one of the health institutions here. And the health institution is not a hotel. I'm not saying that to say that you're not supposed to be treated well or whatever the case may be. But what do you think they're going to give you in the hospital? Salad? Hmm? You think it's that you're going to get? It's bread you're going to get. So try your best to stay out of there. The purpose of the hospital is for emergency. Good. So I'm saying all of that to say that in order, so when you have the lifestyle problem now, you have diabetes, you have arthritis, doctor telling you, hey, all the cartilage in your knee gone, you have herniated disc, you have sciatica, we have to do surgery on your back. Nope. Get a second, a third, a fourth, a fifth opinion. Do not have people cutting you open just like that. And I say this respectfully without any hesitation. We do too much of surgeries in this country. Doctors run to cut you for everything. And that is unfortunate. And I'm not saying that we do not have good doctors, but you need to mind your business. Why do you want to do or put injection in somebody's eye, especially if they are diabetic? That doesn't make any sense. One of the problems that diabetics have is that they have a serious problem as it relates to healing. Remember, one of the main problems with diabetes is that because it is so inflammatory and so oxidative, it breaks down the body. So it makes healing very difficult. So why inject somebody eyes who is a diabetic? I personally find I would not recommend that. That is where I give you a holistic protocol now, and we get your vitamins, we change up the diet, and then give you the results that you get. Someone actually commented on our social media. Keep in mind, we are live on our social media platforms. We are Batson and Associates Limited on Facebook, on Instagram. We are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad, and on TikTok, we are Batson and Associates. Miss Frederica Joseph, she says, good morning, Dr. Batson and Associates. Thank you for all the good advice and great products. Eye Optics Formula, greatest product ever. It works. And we have a lot of testimonies with our eye drop. The IT is also a very good product as well. And that helps with, especially those of you who, these phones we have. A lot of times people don't understand that when you look at your phones in the night especially, so your bedroom dark, and you're looking at the phones, you have to be very careful. Those lights cause a lot of problems. So you have to take care of your eyes, and especially more so if you're diabetic or hypertensive. Lady G, I know it's 11:25. I'm not 26 right now. So how are we looking in terms of our time? We have until 11:40, is it?
11:45 today.
Okay, great, no problem. So we could go back to the questions.
All right, so morning to everyone. I have a friend who has no sensation towards the sun, air condition, or flames. She also does not know when to pass urine, etc. She is diabetic as well and very depressed with suicidal thoughts. You were just talking about mental illness. She's asking, she's 47 years and presently on sick leave. Can this be a form of mental illness? The person is asking.
Well, the thing is, I would say yes, to the extent that, if they have diabetes, I mean, you're already at a serious disadvantage there, in the sense that you have high oxidative stress in the body. The body is in a situation where it breaks down easily. So you find that the organ systems that are affected by diabetes is primarily the neurological system as well as the circulatory system. The possibility exists. Of course, I'll have to do some more or get more information diagnostic wise, that it could also have some aspect with PMS. This because why I say that the PMS is becoming more and more and more a problem, and the reason why I think I have so much experience in it now is that so many persons we have treated. I remember, I don't know if you ever saw someone get a panic attack.
No, never.
Never. Okay. A panic attack, seeing or experiencing someone going through a panic attack is not a nice experience. If you're not trained, you both all in problems, right? And I remember I have seen persons actually get panic attacks in my office or in our locations. And it's not a good sight because of how the mental aspect of the body. So let me say this. The central nervous system, even though your gastrointestinal system is the most important system in the body, so that's the system that deals with the proper assimilation or digestion of food, as well as the system that deals with the removal of waste. So pound for pound, if there is no argument based on anatomy and physiology that the gastrointestinal system is the most important system in the body. The fight after that is between the cardiovascular and the central nervous system. But I would say the central nervous system because of how intricate the central nervous system is, because you have your autonomic nervous system, which is your sympathetic, parasympathetic. So that controls flight and your fight and flight response. What a lot of people do not understand, even things like your bowel movement is actually a central nervous system function, because there has to be stimuli and whatnot, and that your whole autonomic nervous system is what controls that. So I'm saying all of that to say that they made mention that when she needs to urinate, she doesn't even know. So that is a dead giveaway that the central nervous system is significantly impaired. So what it could possibly mean is that some nervous breakdown. And the thing is, let me explain something quickly. You can have a nervous breakdown and not have a nervous breakdown. I'll say that again. You can have a nervous breakdown and not have a nervous breakdown in the sense that people looking at you and you for yourself, because of not knowing certain things, didn't realize that is a nervous breakdown you have. I'll give you an example. You heard about postpartum depression already, right?
Yes.
You know what that, okay, good. So think about it. And I spoke about this on Thursday when I was doing a program. All mothers, well-functioning mothers, they automatically or automatically, sorry, naturally would protect their children, right? There is no problem. They're going to go to the ends of the earth to protect their children. And that applies to all aspects of the animal kingdom. Lions do it, marmots, everybody does it. Whales, everybody. They're going to literally kill for their children, and they're going to protect their children down to the last. Postpartum depression is a situation, and that's why I say you have a nervous breakdown and you do not have a nervous breakdown. Women with postpartum depression, every last one of them is a nervous breakdown they get. Yeah, you're telling me they have postpartum depression, because postpartum depression or depression is the secondary consequence of the primary cause, which is a nervous breakdown. Your nerves shut. So the mother now, or this human being, does not have the ability to differentiate based on the nervous breakdown, the difference, and she will try to hurt her child.
Wow.
Yeah. And think about this. I told somebody this because I deal with people who have serious depression and this PMS. I dealt with a woman with PMS. Let me explain to you how bad this thing is. And I always tell persons this, and I never give name or anything like that, because I would just reference certain things. I know how to hide things, but giving you all the information that I need to give you all without disclosing people's business name and that type of thing, unless they give a testimony. And most of our testimonies, depending on how it give, it could be written testimonies, whatever the case may be. Anyway, this lady came to me, again, shaking. So the symptomology was depression, anxiety, crying spells. These women, you would be in a wedding, people married, the place, music playing, everybody happy, and you just in a corner crying because of the emotional upheaval that you're going through. And imagine a mother, a woman who is a God-fearing woman, will sit down and tell you that the only reason she has not committed suicide is because the insurance policy that she has is not able to take care of her children. And that is what stopped her. You understand what it is I just tell you? So that is to tell you the mental state of mind that you are in when you suffer a nervous breakdown. So most of these people, when they tell you that bipolar and mental illness in families, the reason why mental illness runs in families, like most things, is because you continue there's a saying we have, genetics load the gun, but lifestyle pull the trigger. So you may have some disadvantages, You may come from a family that is prone to diabetes. I come from a family that is prone to diabetes. I do not have diabetes, and after God, I will never get diabetes. I am not going to get it. The last time I do an A1C, it was 4 point something. I do not play games with sugar and certain things. I don't eat it. So the thing is, genetic loads the gun, but lifestyle is going to pull the trigger. And if you, and what happens to a lot of persons, and that's why psychiatrists tell you, do you know that in the professional world, people who are psychiatrists and counselors have one of the highest levels of suicide in that profession? You know why? Based on the same thing that I just explained with energy. When it is you deal with people, these people getting negative energy on a constant and a daily basis, you sitting down and having to counsel persons who are rape victims, persons who are, yeah, that's not nice energy you're getting there, but you have to get it out. The point is, those people do not know about things like grounding and bringing back, because we are taught to bring back our energy in alignment with certain things. Because I deal with difficult things on a daily basis. Sick people, you know, it's to deal with sick people every day. But I love it. But I have to do things to bring back myself mentally, psychologically, emotionally within a particular balance. And that's very important. Because if you give, and you don't ever put back, you're going to reach a stage where you're in problems. All right. And that applies to all of us out there. When you're taking care of your family, make sure, because you take care of people, make sure and take care of yourself. Take some time off and take care of yourself. Get yourself checked, because the problem, and that's why I started the program at the genesis of the program. That is why I touched on hypertension. And coming on to the end of the program, I am going to touch on it again. Please, if you have, we can help people with high blood pressure. I had a number of that circulation regeneration tea. That was one of the things that we got for that. I have other things that we use too. If your blood pressure is high and it is uncontrollably high, there's a reason why it is uncontrollably high. I am saying to you, if it is you decide to come to Batson Associates, if you decide to take anything from us, before you do that, look at a few things. Look at your hydration. Very, very important. Okay. So with that being said, we will just call those numbers again. And of course, you have any more questions on your side, my dear?
Oh, yes.
Yes, go ahead. She said, oh, yes, they're asking questions today. I like that, man. Can I give them a 5 hours today?
Once I'm on, people will just be chiming in.
All right, Lady G, all right. As far as I would a dignitary. That's nice. That's nice.
You see the messages come like, y'all are talkative this morning. Anyway,
Yeah.
this one.
Good morning, Kalki, Luigi, and Dr.Batson. I have one that's 19 months old, and she recently developed an infection. I took her to Moto and they gave her some antibiotics. But what I realized with her now, her whole skin is buttons and rash now. The antibiotics, I don't know, but I recently started giving her the complex and 7 C's caliver oil. So I don't know if it's because the medicine clash together. I don't know, but her whole skin is in rash. Any solution? Stop the antibiotics. Go back to the emergency room. I like to know what is your take on this.
Okay, so based on everything I heard there, the only thing I need to clarify, she said is how old is 9 months, she said?
Yeah.
9 months. Okay. Well, definitely I need to go back to the doctor. You should contact where the medication was disseminated and that type of thing. I think based on what she said is one of the healthcare facilities. So you should go. Yeah, so you should go back and let them know, carry back the child and let them know what happened. What I could say going forward in the future as regards to children, babies, especially with, so if you have very young children, babies with things like eczema, things like problems with a lot of buttons coming out of the skin issues. They having problems with digestion, so the children or babies, you find they have constipation problems and those type of things. One of the safest things immune wise that I have seen with children is the silver with the mineral formula. Because the thing is, when babies, let me give you an example quickly. When women give birth to children, and these women have STDs or STIs, so sexually transmitted infections or sexually transmitted disease. So let's say, for example, chlamydia. The thing is, that child, as the child is born, they have to treat them with silver eye drops. Now, you can do the research that is actually used in hospitals, right? And that is because of its ability to boost the immune system, get rid of pathogens, either virus, bacteria, fungi, those type of things, and actually bring balance to the system. So it's a very easy thing, and it's a very safe thing for children and for babies. I have treated children with eczema with it. Of course, there are certain guidelines that you need to follow. And of course, each situation may be the same, but maybe slightly different. So, some sort of consultation may be needed there. But it is very, very safe for children. And on that note, too, parents, we know, well, school, and then the time of the year coming up, you'll notice we have some interesting viruses. This time of the year, we just get them. And then Carnival coming next year, we're going to have a few as well. And we have a lot of spin-off from COVID. This virus that we have going around here, you'll realize how bad it is, right? I get a little touch because I did some clinics and I dealt with some children. And children, the little touchy. I was as diligent as I was supposed to, but I think, something passed a little bit. And I got a little something for 2 days. I dealt with it as quickly as possible. But what I will tell you, this virus that have going around here, it not nice. Yeah, it different. And that's because we having all these spin-off from COVID. So that virus going around is something with it's a relation, is a cousin somebody to COVID, in my opinion. A very distant cousin, yeah.
They've been getting, shortness of breath.
Shortness of breath, diarrhea. The diarrhea for me was the concerning thing, and that's to tell you how bad it is. Because, and not only that, it is also an influenza virus. Influenza viruses are the worst type of viruses. Those are viruses that attack your lungs. So people who have asthma, tuberculosis, if you have sinusitis, you need to watch yourself and be very careful. And if your dairy intake, you need to be very careful. You should try and stay off of dairy, lessen the dairy, because dairy encourages film and mucus in that whole respiratory system, which will make a virus like that 10 times worse. So you need to be very careful with that. But that silver mineral formula is something you should check out.
Still a baby. So what doctor was saying is that you need to go back to the health facility. So not 9 months, but 19, right? All right. Okay. Yes. Steel-tip boots. I was clean. I wear clean socks every time. All righty.
That's the person who asked about the water bladder.
Yes.
Yeah. Okay. So I believe that maybe you should look at the aspect of circulation. Yeah. Definitely. So they said it's a steel-tip boots they use.
Yes, steel-tip boots.
Yeah, I know. My mind told me that. But what you have to understand with steel-tip boots, and this is something that I found with a lot of persons. Remember, there's a heavy boots. Remember, you have one, and then steel-tip boots are very hard. So that's why I say what you may have to do is maybe look at the size of the shoes and get one of those soles in there, or have the socks that you could wear to give you some more support. Because those boots tend to cause some problems. If you, especially physically, you need to be in terms of how you maneuver yourself. Remember, it's very heavy and you're walking. In some cases, you might jump down somewhere. So you have to be a little careful. So I believe it has a little situation with circulation there as well.
Somebody's asking this. I mean, it reminds me of my situation as I have osteoarthritis. But morning, Dr. Batson. Can you talk about the cracking sound of the knee, which is what I get?
Yeah, well, I mean,
Lady G, it's a pleasure hearing you on this morning. Blessings to be here on a Sunday morning, as I say. Really enjoying the program, guys, with you and Dr. Batson. We have a lot of questions. I don't know if we'll be able to. We only need 3 minutes left to go.
Yeah, well, what we're going to... Yeah, well, one of the things we're gonna do is actually have a question and answer. Well, I don't know if what we yeah,
Did last week.
yeah, what we'll do is we'll do a question and answer tonight. So I will do an hour and a half question and answer. The only thing with that, they're gonna have to join me on social media. So keep in mind we are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. So I will do a question and answer tonight. That question and answer would be from 8 to 9:30. And what we could do, I don't know, I would contact Shakil and maybe he could send the questions for you. And or you could send the questions for us, sorry. And I will do that that service. All right, that is not a problem.
I'll just forward all the questions.
All the questions, yes. And I
yes, you could answer it and start the program.
Yes.
Later tonight.
Definitely. So keep in mind again, that's Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. As usual, this is a pleasure to have been in your company. I tried my best not to buff too much this morning, but I was as stern and as assertive as I.
This morning, I think that's like
Yeah. Yes, I tried. Well, maybe they told you, well, no. After I realized I deal with you, I say, all right, let me behave myself a little bit. All right. To the listeners of Sky 99.5, always a pleasure to be in your company. As we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. Remember those telephone numbers again. Shogunas First Floor Money Talks building in Montrose. Shogunas, that number is 222-8261. That's 222-8261. Debe is the corner of Ramsey Mood Trace and the SS Erin Main Road in Debe. That telephone number for Debe is 223-7515. Check out our inflammation formula, nerve restore if you have a problem with sleep, our eye optics formula, and so many other products, good products that we carry at Batson and Associates. Circulation regeneration, check that out. Boss Tea as well, good product. And of course, St. James is Red Edge Mall, Western Main Road, St. James. That number is 220-8113. And Tobago, remember, we in Tobago from next week, please God, those 2 weeks. And that number is 226-4553. Again, 226-4553. Remember tonight, that question and answer on our social media would be from 8 to 9:30. Lady G, it was a pleasure. Take care of yourself, and we'll be in touch.
Thank you. And I'm going to try that gelatin and that CMOS, because I did start the CMOS and I did it for 1 week and I realized that the pain was decreasing.
Yeah. There's also stick with it. And there's a product we carry at Batson Associates to you that is called Inflammation Formula. You do me a favor. You give me a call my office, and I'll talk to you, and we'll sort you out, man. We'll sort you out. You have to keep those knees. Functioning, man.
Yes.
All right. I
be able to walk down the aisle as yet.
No. You have it. You gotta be.
I live down the aisle.
Tell them three things to spoil our outfit, you know. A walking stick, a big belly, and bad knees. So no.
All right, Dr. Batson, it was a pleasure being on with you this morning live.
Same here, my dear. Same here.
Health issues, we intend to do that for 2023.
Yes, definitely.
And now we don't wait until 2024 and making no New Year's resolution.
Exactly.
We're looking to do it now. So get in contact with Dr. Batson ASAP, guys. Have a good one, Dr. Batson.
You too. Take care. God bless.
God bless you too. I'll give you a call. Don't worry.
Okay, nice.
Recall.
Yes, guys. So you all heard that. So tonight, so Shaki will just need to get some information. So I'll answer those questions as well as on our aspect here. Keep in mind, we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. Miss Annabella Bay, my dear friend. Let me say a pleasant good morning, guys. Well, you all saw what happened on the radio, so I couldn't really rap with you guys as I would like. Annabella Bay say, see you at 8, don't be late. Yes, my dear. Miss Sharon Theodore, a pleasant good morning to you. Miss Rachel Johnson, Miss Petronella Joy Felix, Evita Byron. You're very welcome. Miss Kathy Samaru, Nikila, Lacote, George, Randy Regis, Miss Pamela Moses, my dear, Cheryl Cooper, Miss Donna Williams, and all those of you who took time out to message. I know as regards to the Londonville office, yes, we almost finished. So we almost completed what we're doing there. So very soon that office is going to be opening. If we don't do it at least by, because remember, we're down to the end of the year already. So that's something we're definitely working on. So guys, take care of yourself. God bless you guys. And tonight, make it a date, don't be late. It will be from 8 p.m. to 9:30 p.m. Take care, guys. God bless and enjoy the rest of your day. Remember, put some salad with that food today. Have some greens.